Can I go to the table here?
Sure. Is it because it's after lunch and you need to sit
Right.
down?
Yeah, please. Oh, well, thank you so much, Madam Chair and members of the committee. This is House Bill 157, LC number 336927S. And what we're looking at doing right here is striking some language that was added to a bill last session. So the first notes that I made just says, why are we here on this bill? And to just try to be as brief as possible but thorough. Last year there was a bill introduced that came to this committee that I spoke out against because I was afraid that first and foremost it sounded monopolistic in nature, naming two organizations as board certification organizations in law, just naming them by name, American Osteopathic Association and American Board of Medical Specialty. I thought that was monopolistic. Other states determine the same thing. The other thing that I thought would happen if we passed that legislation was some rural health care consequences. And so I came into this very same committee room, standing at that podium, and pled with you to please stop the bill, and Senator Judson Hill was sitting where I am now. So in just kind of learning all of this process, I believe Chairman Reinders made the motion that you tabled it in this committee, and it just sat there. And so I, not really knowing any better and just kind of thinking, well, whew, that was a relief. We stopped it. Here's why we're here. On the 40th day, in the 11 and a half hour, I mean, it literally was 11:30 to midnight, Representative Trey Kelly stood up to the podium to present House Bill 1043. 1043 was a bill that he had been working on with Chairman Cooper. It was a vaccine bill, et cetera, but conveniently, the language happened to find its way back onto that bill and over to the House at 11:30 at night on the 40th day, of which had this very same language. And so what this does is this strikes that language from 43-34-22.1. And I would imagine most of you would agree with me that anytime you circumvent the best process of passing legislation, where it goes subcommittee, full committee, pass from full committee to the rules, to the floor, to the Senate, etc. That is the best process to pass good legislation for all of Georgia, metro, rural, north, south, east, and west. That's why we have 180 state representatives and 56 senators. So everybody gets a say. When you attach language from a bill that was clearly tabled and killed in this committee, or stopped at least, I don't want to say killed, you probably are going to have some unintended consequences, which is why we are here today. Now, in saying that, just simply put again, I'm asking in HB 157 to strike that language that was slipped into a bill last year that passed back through the House and was then signed by the governor later. I even pled with the governor, but it was attached to some good legislation that went through the whole process, ironically. And that was good legislation. So I want people to hear what I'm saying about how this impacts rural Georgia most of all, and I'm just going to stop and answer questions. When I began to get calls on this legislation, everything I heard was this is going to kill the ability of some of your rural hospitals to recruit physicians from all over the southeastern United States that may not be board certified in American Osteopathic Association or American Board of Medical Specialties. But there are a number of other very credible, reputable, well-respected board certification organizations that they can be board certified in. So what it came down to was a turf war or a battle between the plastics and the dermatologists up here in the metro area. And I don't want to get into all of the craziness of metro versus rural because this is one Georgia and we're all in it together. But the only promise I made to my people where I'm from in rural South Georgia is I promise I'll be a voice for South Georgia. And I want to keep that promise, and I'm sitting in front of you today. Madam Chair, I'll be glad to take questions.
Okay. I think you're forgetting one important thing about this. If this bill is repealed, if the committee decides to repeal it, I have promised that I will call
Yes, ma'am.
all the parties together over the summer and see if we can come to any solution
Good point, man. I want to say that too, Madam Chair. My commitment is not simply to strike this language, but, and we had a meeting the other day with several of the docs, some for, some against, and different things. I've committed to the other organizations, Medical Association of Georgia and others. I want to work over the summer to help draft something that does not specify who, but it sets standards as to how. Government should never name who. We just decide how, and anybody that achieves those standards is welcome.
All right, questions. Representative Price.
Representative Lewicki, you probably remember last year when I introduced the identical bill in the House, and it did pass this committee, and I spoke to it, and it did pass on the floor. So it has passed the House chamber once,
Yes, ma'am.
and I mean, it's identical, same words.
Right.
And then simultaneously, the same bill was offered in the Senate by Senator
Judson Hill.
Judson Hill. And so I'm just suggesting that it's not that we didn't address it here. We actually
Right.
did.
Mhm.
It's just under a different bill number. It passed here, and it went to the floor. I spoke to it, took questions, and I think it passed. I don't know that there were any objections, maybe one. There was one vote against.
Yes, ma'am.
So, I mean, it's duly gone through
Yes,
our
ma'am.
chamber.
Yes, ma'am.
And I'd just be really concerned about,
Okay. You mind if I respond to that?
sure. Well,
I have a
through the
question
chair.
first.
Okay.
Representative Price, what happened to your bill in the Senate? Was it heard in Senate Health and Human Services?
I can't remember. I believe it was, but at
No,
that
ma'am.
point, it was coming this way, so we just decided to let it ride.
Okay, and I think what happened was, if you'll remember, by the time we had passed it out, we were beginning to hear exactly, except from the representative.
That's right.
Maybe he was a freshman and we weren't paying real close
Right.
attention to him. But we were beginning to hear from other rural legislators that perhaps there really was a problem with this bill,
Right.
and that we slowed it down, and we thought we had
If-
put a stop on the bill.
If you'll notice, one of the tricks that most legislators use is dropping a very simple bill that does nothing. And then all of a sudden, a little old country boy from South Georgia starts getting lit up with phone calls, and he runs and starts digging a little bit deeper and finding out a little bit more about the unintended consequences of a turf war that you're having somewhere else that's going to have a statewide impact. So you're absolutely right, Representative Price, that it did pass through, but that is exactly why it goes from the House to the Senate, is so I still have another opportunity through a senator in my area of Georgia to stop it. And that bill did not get a hearing in Health and Human Services because Judson Hill saw to it that it didn't. His bill did, and that's why I stepped up to this podium. He wanted his bill to pass so he could get the credit in your district for getting this done for a very small group of people. That's right. That's right. And that is exactly why this process works the way that it does. Yours didn't go very much further over there because I had Senator Harper checking on it there. But he said Judson Hill was not going to let it go for a hearing. I said, well, I'm on my way to Health and Human Service in the House, and I'm going to try to stop his version. He was literally sitting here presenting his bill when I walked in that door with 15 seconds to go and threatened to stab myself in the face with a pencil if we didn't keep talking about rural health care and then pass laws like this. He got mad at me after the meeting, but he was fixing to try to have that done here without giving anybody an opportunity to address the concerns of rural Georgia that we had in this bill. That's why there's two chambers and we get to do it both ways.
Representative Sharper. Mosby, I'm sorry. Representative Mosby.
Thank you, Madam Chairman. Glad you didn't stick your pencil in your face.
That's right.
Okay, so,
That's right. Me too.
So in striking this language,
Yes, sir.
in this interim time period,
Yes, sir.
are there any, I'm going to say unforeseen, anything that you could see that could happen in this interim time period that could be negative?
After
process.
striking the language,
Mhm.
no, as a matter of fact, of the doctors and the ones that showed up at our stakeholders meeting, the question was asked specifically, did any of you have any problems at all before this language was slipped onto this legislation to change? And overwhelmingly, there was not one person in the room out of 20 plus that said, no, we don't have a problem.
We're going, I mean, it's my understanding we're going back to where the law was silent before, and, then we don't have any problems with it. Representative Reinders.
Thank you, Madam Chair, and I do remember this, and there was some consternation. It was sold as one thing and some discussion, but I just want to make sure that I understand, Madam Chair, it is your wish, and I support you, it is your wish that we bring the parties together during the interim to make sure that we don't have any unintended consequences by passing bad legislation or good legislation, and everybody has a chance to be heard. We do this all the time. We constantly tweak, and all you're asking is simply to go back to square one, bring the people together, and see if we can't come up with something that works for all Georgians.
That's right.
And with that, Madam Chair, at the appropriate time, I'd make a motion to pass.
I have some people, I will hold, if you'll hold that, I have some people who want to speak on it. Several doctors, Dr. Meadows, Dr. Smith, Dr. Khan, and I can't say it. And he's very nice. He was at the meeting. Pronounce your last name. Puda, okay. Are you in favor of the repeal, or is there anything earth-shaking that you need to add to this? Or are you against it? If anybody's against it, would you like to come forward and speak? Or if you feel like you need to add? Okay.
I would like to add to.
You are, if you'll step to the podium. And you are?
I'm Dr. Eugene Smith.
Okay, Dr. Smith? Go ahead.
Okay. Well, thank you, Madam Chair, and thank you to all the members of the Distinguished Committee for letting me speak. And Dr. Price, we're very proud of your husband, by the way. The problem with the Judson Hill attached language to 1043, and I think this affects all Georgians, is that the ABMS is not kept up with specialization. And this really denies patients access to super specialists. And I'm not saying this in any way to promote my career. Mine's stable. I've been in Georgia 17 years. Everything's fine. But I think patients really have the right to information, to access information. They should be able to go online, do a Google search and say board certified specialist in, cosmetic eyelid surgery. And they should be able to find all the surgeons that specialize in that area, okay? My specialty is such that I trained in eye surgery, then did additional training in oculoplastic surgery. The requirements for that is that you have to submit 1,000 cases as the primary surgeon. You have to take a oral and written certification exam, and you have to write and publish a thesis. So by all accounts, oculoplastic surgeons are recognized and specialists in eyelid surgery. This language prohibits us from advertising that, and it prohibits patients from finding us. And my specialty is really developed into fixing cosmetic surgery complications. And every, I see, and I've got many examples of patients who have had, and I'm not here to attack any group of doctors, but I see many patients that have had surgery by board-certified plastic surgeons that have had complications. And if they go online to find specialists, a super specialist in repairing these, they can't find them with this language. We've now been excluded. And so that's a problem for all patients. I think all patients should have right to information. And I have many examples of patients that I see with all types of complications. But based on this language, if they go online and they type in repair of cosmetic surgery complications, they're only going to find other board-certified plastic surgeons. And the ABMS has not kept up with the specialization of medicine.
Okay.
So,
Representative Price, do you have a question for the physician?
No, I just had it on from before.
Okay. Do any of the other physicians need to add to that? Okay, no. Thank you very much.
okay, thank
For
you.
coming.
Thank you, Madam
Okay,
Chair.
I'm ready. Representative Reinders, if you want to make a,
Thank you,
Proposal.
Madam Chair. I move the committee do pass substitute to House Bill 157.
Do I have a second? We have a second, so we have a do pass and a second. Is there any further discussion from the committee members? Okay, everyone in favor of the passage of the substitute to House Bill 157, say aye. Anyone opposed, no? No. You did a good job. You did a good job, Representative Price, but the ayes have it. Okay, thank you.
Thank you.
All right, the bill passes. Okay, thank you very much. Oh, Representative Hawkins, you're up next. Okay. And this is House Bill 241. Do you want to bring somebody up with you, or just a minute?
Yeah, let me make my statements.
Okay,
and then
that'll be
we'll let him go
fine.
over to the, I've got a really bad cold, so I'd rather him speak from over there. Me
That's
not
a good
really
idea.
get
Let's
around
keep it
him.
away
Yeah.
from the baby.
As you can tell, I'm very hoarse. Madam Chairman and committee, I apologize, I am pretty hoarse. But I can get through this. What you've got here is a piece of legislation that actually came to fruition this summer. I was visited by some friends and people I've known for a long time from up in White County, and I was unaware of something called Krabbe's disease at that time. Krabbe's disease is an autosomal recessive neurogenital, excuse me.
You want a little help? Go ahead.
Yeah. It is a disease which causes myelin formation to be inadequate in the brain, and myelin is the wrapping of the neural tissue. So there are other diseases similar to this, but not in this really destructive type of form. There's an infantile, there's a adolescent, and then there's an adult form. The infantile is the one that we're discussing here today with Krabbe's disease. Children that do have Krabbe's disease do not typically survive after 2 years after birth. It is more prevalent in Georgia because of the gene pool here, that being Scotch, Irish, and Scandinavian. We see and believe it to be 3 to 5 births per 100,000 in the state of Georgia. What you've got here is some legislation that addresses this in what I feel is a common sense approach. I came about this with speaking to some of the experts in this field, Joanne Kurtzberg, Escobar. Joanne is at Duke University. Escobar is up in Pittsburgh, and also some other folks. Jim Kelly, the quarterback for the NFL quarterback. Hunter's Hope, his son, if you're familiar with that, also had Krabbe's disease and died. So anyway, after going through this and looking at all this, my approach is pretty straightforward, and it's more like the approach we used to have in medicine. And as you will see in the bill on page 2, at the top of the page, line 30 through 32, that the Krabbe's will be conducted at the option of the parent. Okay. So also now thank you. I apologize. When children are born, there's a newborn screening test done. It's called a Hill prick. At that point, 31 different diseases are tested for on a child. We do this in the state of Georgia. This is done in labs in the state of Georgia. Krabbe is not one of those we're being tested for right now. With this bill, it will be tested. As you will notice that on line 43 through 44, it will also be paid for by the parent. The reason I have that in the bill is that New York University, their lab has verified that they will do the test for $3 to $5 per child. You heard me right, $3 to $5. No Medicaid involved with this, no insurance involved with this, straight cost to do the test. So like the old days in healthcare. Also on lines 52 through 53, you will notice that the testing for this may be done outside of Georgia. That's because the New York University's lab obviously is outside the state of Georgia. It says may because as we've worked on this bill, and I've worked with DPH to get this bill worded so it'd be easy for them to conduct, Emory has now shown interest in being involved with Krabbe's testing. So, in conclusion, what we've got is a disease that is fatal, if not discovered before the age of, say, 6 to 8 months after birth. It will be tested for either in an in-state or out-of-state lab. Cost is $3 to $5. The parents will be informed when they get the pamphlet that's provided by Department of Public Health. In that pamphlet, it will tell them that this is at their option, what the cost is, and they will be notified like the other test in a reasonable amount of time. If there are no questions, we will have a couple folks back here testify.
Okay,
And I apologize about my throat.
sorry. Questions for the representative? No questions, okay? You want to call the people and introduce
Who
them?
wants to go first?
You can go to the podium and tell us who you are.
Do you have any tissues in the room?
I don't think so.
Hope I can make it through this. You do? I
There
may
we
not
go.
need them, but I'm ready. Thank you very much. Thank you. Sorry, I really appreciate that. Good afternoon. My name is Brooke Adams. I am actually not Braylon's sister. Braylon is the mother of Cove. Everyone thinks we're sisters. We are actually first cousins. We grew up, our fathers are brothers. We grew up right beside each other. So for the most part, she is my sister. I would like to thank Representative Hawkins for sponsoring this important bill and also the members of this legislative body for your consideration of Cove's Law. Thank you for your willingness to fight for the lives and the quality of life for all of Georgia's babies and their families. Cove Ellis, the daughter of Andy and Braylon Ellis, was born on July the 10th, 2015. She is a beautiful child, but she was even beautiful at birth when the majority of us resemble small aliens and amphibians, in my case. She was progressing normally until around the age of 6 months, when it became apparent that her gross motor skills were noticeably delayed compared to her peers. She was diagnosed with Krabbe disease at 7 months. We had never heard of the disease, but we certainly understood the implications of life expectancy of 2 years. Those are words that take your breath away. It was those words that dropped me to my knees as I was leaving my classroom the day that I heard the diagnosis. The next question is always, is there anything that can be done? And the simple answer is no. The hardest part is the understanding that if she had been born in another state that has passed this legislation, that something could have been done. Her life could have been saved. I cannot tell you how difficult it has been for Cove, for Braylon, and Andy. I cannot tell you how difficult it has been as someone who loves them to watch their agony. I would graciously like to ask this committee to pass Bill 241 so that more Georgians can be educated about Krabbe disease and other leukodystrophy diseases. Also, that parents can have not only an option to screen, but an affordable option to screen. While this option will not benefit Cove or our family, nor Jackson and his family, perhaps it will save the future life of a child and benefit that family. Thank you.
Thank you for having the courage to stand before the committee. We really are no different than you are. Before you got away from it before I could ask you a question.
Oh, I'm so sorry. I'm so sorry.
Okay. First of all, and I have an advanced degree in nursing and taught pediatric nursing up in your area. And I will say that I've been here a long time and chairman of this committee since 2005. And this is the first time we've heard of it.
Mhm.
So that's not an excuse, and it's a terrible thing that we're just now hearing of it, but thank goodness I can say that, and it's not that we heard of it and didn't take action. So for that, what is the treatment if we had known about it and could have gotten Cove tested?
The treatment is a stem cell transplant. The treatment they have to receive the treatment before the symptoms of the disease appear, before the myelin sheath is damaged.
But they are having good results with it, so
It is a rare disease. Some children are so far living a healthy life. There have been other children where there's been some complications.
sure, with stem cell transplants that does happen. Thank you very much again for coming. Okay? Who else?
April.
Thank you, Madam Chairman. Thank you.
Now,
guys
I'm a
for
big
taking the
bear
time.
lover, and you're gonna have to bring the tissue up here. If you're gonna show,
Yes.
we're gonna get the bears into this with the little ones. This is
I
gonna tear
understand.
my heart out. Okay.
So, first of all, thank you for commenting that you had not heard about Crabbe before, that they had not been brought to the attention before. Thank you.
You're welcome.
So, the discussion we're having on Crabbe is an opportunity to talk when we can do something. When our Jackson was born, healthy and round and full of curly hair, everything was perfect. And then at 5 months, when he did not want to eat so much and became fussy, my worst fear was colic. After 4 days on the PICU at the 4th floor of CHOA at Eggleston, they said, we had something we want to talk to you about. I'm like, well, we're kind of on first name basis at this point. Can we not talk? They said, nope, you need to come down the hall. And you know the room that we go to. It's line to line with 12 specialists from 3 different practices: neurology, generalists, and genetics team. And they said, we know what's wrong with Jackson. Great. It's a big delays. Great, come on. It's a leukodystrophy, okay? That pause was for me to know what a leukodystrophy was and fall out. I didn't know. So they got to say the word Crabbe. Nice long pause. I don't know. They had to go ahead and tell me that your son has a lifespan of 1 year. And actually said, starting from when? Today? From his birthday? From when you told me? Are we on the clock now? They were very beautiful, humble people. And they said, you will read a lot and research a lot. We're going to go ahead and tell you there's nothing that we can do right now. We've looked at his MRI. His myelin sheath is affected. He won't benefit from any transplant. Yes, there is something that's out there. Yes, it would make a difference. We're not trying to deter you. We just want to be honest. It's not going to happen. I said, thank you, because you already know what I'm going to do. I'm going to Google the heck out of it, right? Because I'm the mom. You know what the advice is? Go home and take pictures. Am I telling the truth? So we have pictures. And as much as I love this family here, I'm not supposed to know them. The genetics team brought us together. We were diagnosed in in January of last year, and them in February. And that's how I know these fine people. As grateful as I am to them, I would just like to ask, I don't want to meet anybody else. When they think about Crabbe and they think about Jackson, I don't want to meet them like this. I want to meet them on the other side in my home state so they can say thank you and not now what. Thank you for your time.
Thank you. Are there any, thank you for coming. And I am so sorry for your loss and the anticipated loss of this little cove.
Madam Chairman, may I just say a word?
Yeah.
I appreciate the committee listening, and Madam Chairman, you're absolutely right. A genome disease, there's many genome diseases that go undetected, and with modern science, modern medicine, we're starting to see a lot of them. Like I said earlier, Georgia unfortunately has a very large population compared to other states of Scandinavian descendants, Scottish Irish. So in our state, the possibility is greater. And until we know what genome diseases are out there, we don't know how to test for them. So this is a fairly new one, you know, in our recognition, our ability to recognize. But we do have there is a possibility to treat within the first few months of life. It is harsh treatment. Survival rate or morbidity is high with the children, but this is the only chance they have. So this bill does not create any cost to the state of Georgia. Like I said before, it's at the option of the parent. But what it does mainly is it puts into this form, which is given to the parent, the information that they can then choose to have that baby tested with no additional bloodletting or drawing is taken when they do the newborn screen. So with that, I will.
Rest your case. Representative Reinders.
Appropriate time, Madam Chair, do pass.
Okay, I have a motion on the bill if it do pass, and a second. I think everybody on the committee probably adds their second to that. Is there any discussion from the committee? There's no discussion. Everyone in the favor of the passage of, let me see if I can find the bill. Which one is it?
241.
House Bill 241, say aye. Aye. Anyone opposed? No. Okay, the ayes have it.
Thank you.
This is the first step. We have to get it to the floor and get it through the Senate, but you've definitely got a compelling story. Thank you very much for coming. What else? Where'd I lose my thing? Right here. Okay. All right. Okay. Okay. House Bill. Oh, you're welcome. Thank you very much for coming. Safe travels home.
Thank you.
And thank goodness we have Choa Hospital, the Children's Hospital, one of the best places you can go. They're great people over there. Okay. Representative Newton, would you like to pass House Bill 427? You'd like to pass it? Well, come on down and tell us about it. This is your first bill in Health Committee? Well, I said he would like to. Would you like to pass your bill? He's got to come convince y'all to pass it.
Thank you, Madam Chairman and committee. I do appreciate the opportunity to be before you with House Bill 427. The Georgia Board of Physician Workforce has been working for years to try to solve a problem, which is the challenges of rural health care. Many of us live in areas that are blessed with people who compete for our business, who want to advertise for our business, who compete for new hospitals and new opportunities. Large parts of Georgia, however, don't have that opportunity, and so that's one of the things for many years this body has had an organization to try to expand the physician workforce to meet those healthcare needs of rural Georgia. It's still a challenge, and this is one tool that we've been using, which is a loan repayment program for people willing to serve and move to rural areas of Georgia. We've done that with physicians. There's been, for several years, there's been money set aside for physicians for $25,000 a year for up to 4 years for reimbursement to pay back loans they may have incurred during their medical training. If you look, we had some some of these samples with the counties that are considered rural areas in Georgia where physicians and practitioners can go currently. What we want to do with this bill is to expand to another very valuable resource that we have in Georgia, which is our advanced practice nurse practitioners, our physician assistants, and to get good oral health, which is the dental care. So we want to expand that from just physicians being eligible for loan repayment options if they go to rural areas to those other very valuable practitioners as well. Certainly the state is developing a lot of nurse practitioners and physician assistants that are a crucial part of delivering health care in Georgia, both metro and rural, but we want to make sure we treat them well if they're willing to go to a rural area. There is money set aside. This bill doesn't set any money aside. There was already money passed in the amended budget last year, and we actually this body added in the amended budget some money to allow this to go to physician assistants and nurse practitioners as well. I think this is just kind of to clean up the process to make sure that they're authorized to use that money that we've appropriated, and mainly to use the tool that we have so that we can get the job done and improve rural health care. With that, I'd be glad to answer any questions that someone has. As I said, it basically just adds to physicians who are currently able or eligible for this assistance. It adds dentists, physician assistants, and advanced practice registered nurses.
Okay, thank you. Representative Reiner seems to have his hand on the button.
Thank you, Madam Chair, and thank you so much for presenting your first bill here. As I know you're aware, there's been money allocated through the budgetary process in the last few years as it relates specifically to recruitment of dentists.
As far as this, to rural areas?
Yes.
That's what, this is mainly authorizing that, but I think the money's been allocated, correct.
Do you know the amount of of those dollars?
I believe it's $200,000 a year that would, sir?
$200,000 for the dental.
For the dental, $200,000 a year for the dental, $200,000 for the PAs, and I think it's $810,000 for physicians.
Right, I'm having a little fun with you, as the chairwoman knows, and I see our
Yes,
friend
sir.
from the Dental Association in the back. So I just want to make sure that this bill, since you mentioned dentists specifically, does nothing that would undermine the previous budgetary requirements that we've set forth as it relates to recruitment of dentists in underserved areas.
I'm confident the representative knows his subject very well.
The answer to that is, I know and I'm confident that the chairwoman would not let this bill have come before the committee for a hearing if she wasn't sure it was not going to interfere with anyone getting the loans.
If you'd
to
be
go
kind
South
enough to
Georgia.
repeat that.
I am confident that the chairwoman would not have allowed me to present this bill.
Thank you,
if
Madam
it would-
Chair, good bill.
Representative
Yes,
Silcox.
Representative Newton, isn't it true that a lot of people that graduate from either physician's assistant program or any of the other categories here that expand, that the tuition for them is $90,000 plus a year for their schooling loan?
Well, 90,000 a year is probably
Pretty high.
a little high, but
That's
certainly.
that's at Emory.
uh,
It's $90,000 a year. So I think this is I'm just saying, I think this is a great suggestion.
It's a partial tool. It doesn't solve the whole problem of rural health care, but it helps with loan repayment of up to $25,000 for physicians and dentists, and $10,000 a year for PAs and nurse practitioners.
Well, and I think the committee, we are trying to get the universities to recruit people from the rural area, rather than people already in the programs, maybe from the metro areas, because if you already live in an area and you want to continue your education, you're much more likely to go back to that area rather than counting on someone moving from the Atlanta area to Ocilla, Georgia.
Yes.
So, I mean, there is a big movement with the groups to try to encourage people already living and working in the area to seek the higher degrees, so they'll go back home to practice. Okay, seeing no further questions. We have a motion to pass. Have a second? Okay, any further questioning from the committee? None? Everyone in favor of the passage of, I keep losing my sheet,
427.
of House Bill 427, was this a substitute? This was a substitute to House Bill, the passage of a substitute to House Bill 427, say aye. Anyone opposed, no. The ayes have it. You've got the passage of your bill.
Thank you, Madam Chair.
You're welcome.
And I would like to thank LaSharn Hughes, the Executive Director, for doing such a great job with expanding this opportunity for rural health care, too.
Okay, I'm going to go next since I have a bill, House Bill 360 is up next. I may have to leave and turn it over to my vice chair. There's a bill that's going to be presented in Judiciary Non-Civil. It's over the PDMs and making some changes to try to work on our opiate. It's not my bill, but I helped write it, and so if Representative Tanner, who is very busy with the education bill and transportation, isn't available, I will have to leave, so I'm going to go ahead with this one. Okay, House Bill 360 is an updated version of the one that passed out of this committee last year and it was authored by Representative Jasper instead of Jeffries. And he termed it the buddy bill. Well, I'm not using that term this year because it's sort of got, with all due respect to Representative Jasper, it's got to be a little bit of a joke. But chlamydia and gonorrhea, they're not a joke. They have really bad consequences if they go untreated. For women, especially pregnant women, it can lead to all sorts of problems, even death of infants. With men, and I'm not sure we passed it out, so I want you to look in your folders and find, I handed out, I want to do a little education, I handed out information sheets on it. And so guys, check it out. You know, it's not pleasant. With chlamydia, you can get discharge, burning when you urinate, and pain and swelling in your testicles. If you get gonorrhea, it can be a whole lot worse than that, even if it goes into the bones and into where it's more systematic, you can lead to death. So these are not minor illnesses. And we, unfortunately, we're doing a little better in curing these, and now we've even dropped. We're number 6 in the nation with a number of cases. And it is so simple to, in many ways, to curb in a major way this illness, and that is by treating partners. If one person has symptoms and comes in to be treated, they're basically throwing their money away if they go back and continue to have sexual relationships with the same partner. If the other partner was the one that gave it to them, or if they got it from somewhere else, they'll go back and give it to the partner. In about 38 of the states, it is permissible for the doctors. Normally, doctors do not write prescriptions for anyone they have not seen. This would allow them to give medicine to the person who has come in for treatment, but also to send home or write a prescription for the medicine to treat the sexual partner. California, many years ago, passed this legislation or similar legislation, and they set up a hotline that if anybody had any complications, they could report them to that hotline. After 10 years, they did away with that hotline because they had not had one complication sent to the hotline from anyone. So the medicines are old medicines. There are very few side effects. Mainly it could be a little bit of an itch or something like that. And so it is a means for us to move forward and try to curb a really serious venereal disease problem in our state. Representative Henson.
At the proper time, I'd like to make a motion, and I also would like to make a statement with regard to chlamydia. Many years ago, we dealt with this on the House floor. We had Dr. Toomey, who was then head of public health, and to have this covered with Medicaid, it's one pill that can cure this. But it is something that, for a woman, she doesn't realize that she has the problem. And this can cure. It's very, very important that we be able to cure these diseases that people aren't aware they have. I'm 100% in favor of this bill and support it, and just want to thank you for bringing it forward.
Thank you, Representative Jaspers, and thank you for letting me carry this bill this time.
Oh, Madam Chairman, that was a hard decision.
Yeah, right. I'm sure you got teased about carrying the
But
bill.
I just had to make really a comment, not a question, because I learned a lot about this last year. But though you were much more descriptive in your description of all this than I, because you remember I presented the entire bill without saying the word sex or anything.
Well, and I think that's why maybe some of the members on the other side, I hear through the grapevine, this may not be true, started calling it the cheaters bill. And so I thought I'd be really descriptive, so the guys over there got an idea what could happen to them. Not that they're a cheater, but if somehow or other they just happen to pick up one of these illnesses, what could happen to them? And I'm going to explain it that way when I go over to the other side if I'm given an opportunity.
Well, I hope that you let me know when it is, because I do want to be
Want
there.
to be present.
And hope that you do have better luck. And my middle daughter will be very glad that we're still pursuing this. I thank you very much.
You're welcome. Representative Reinders.
I'm just a little nervous right now.
Woo, I'm not, you better not tell Jane.
If we can get Michelle move the question, I
Well,
think it's a good bill. Thank you.
I think that Mrs. Allen from Public Health wanted to give us a brief statement on this, on how prevalent this is.
Yes, good afternoon, Madam Chair, Committee. I appreciate the opportunity to stand before you again. I had the distinct opportunity of sharing some things last year. I think it would be remiss if I left and did not share with you all that gonorrhea and chlamydia, while curable and treatable, can also cause preterm labor. And so prematurity is a problem that we are well aware of in the state of Georgia we need to look at. And oftentimes when we talk about those bacterial infections, we don't have that conversation. Also, we can have ectopic pregnancies result from gonorrhea and chlamydia. And I have had the misfortunate experience of counseling women and families when they have had stillbirths and abortions because of what happened due to chlamydia. So I think it is important to think about this as something that is sexual health care that will allow the opportunity for partners, for whatever reason, who cannot come in. Perhaps it is an access to care. Perhaps it is an issue around scheduling, but this would go a long way for health care. And while we did note that California has had the opportunity to have success we could learn from, we have had contiguous neighbors. Alabama has also passed this bill. Mississippi has passed this bill. I'm looking at UGA proudly displayed. In the name of the SEC, I would love to see Georgia in a conversation where we did something progressive around preventative care. Thank you so much.
Thank you very much. Representative Henson.
Thank you, Madam Chair. I would like to recommend that we pass LC 336940S, the substitute to House Bill 360.
Okay. We have a motion to do pass. We have a second. Any further discussion? We've got, whose light's on? Somebody's light's on. Okay. Representative Price.
I'm pretty sure I voted against this last year for the reasons that I don't like to see physicians prescribing for a patient they haven't either spoken with or examined. So for that reason, and not knowing the antibiotic allergy history of partner or partners as they might be prescribing for, I also think that's a bad idea. And also in other countries where they've relaxed their use of antibiotics, we're seeing a lot of antibiotic resistant bug, you know what I'm trying to say.
Antibiotic resistance.
Antibiotics resistance. So for those reasons, I think this is not a good idea.
Okay. Any further discussion? So, we have a motion on the table and a second. Everyone in favor of the passage of the substitute to House Bill 360, say aye. Aye. Anyone opposed, say no. No. Okay, the ayes have it. Thank you very much. Okay, Representative Price. House Bill 161. You may have to come find me downstairs after this is over, if I have to go to that bill. me to go downstairs? Okay, I'm gonna have to turn the meeting over to you, to my vice chair, my able vice chair. Okay, let me go downstairs. Okay, wait a minute. I have to find the bill.
Representative Price?
In front of me. Excuse me, sorry. Before us today, we have substitute to HB 161, which is LC 336822S. And this is essentially, with slight modifications, last year's bill of 1058, which is related to providing needle exchanges under the auspices of the Public Health Department. And that's the additional change in the bill for this year. Last year, this passed through the House unanimously, and there was some resistance in the Senate, so we judiciously decided to wait on it until we could educate folks as to the importance of this bill. It's really, there's a public health epidemic of diseases being spread through dirty needles. We definitely need to curtail, especially HIV, which is very costly over the lifetime of a person who has that chronic condition, which is now a chronic condition. At the time when it first came on the scene, it was killing people, but now it's a chronic disease, but it's very expensive to treat. The other conditions spread by dirty needles are hepatitis, and that also is very costly should you be one that goes on to have chronic active hepatitis or cirrhosis or even liver cancer. So that's the real reason that we want to not have dirty needles around, is to prevent the public health epidemic of spreading other diseases. Right now in Georgia, we're the number 3 state in the country for new HIV cases. We're number 5 in the nation for people living with the HIV infection in their blood. A person in Georgia right now has about a 1 in 51 chance of being diagnosed with HIV. This, of course, is much less if you don't have dirty needles or any needles at all. And over 53,000 Georgians live with HIV, and half of them have the full-blown AIDS presentation. Vice President Pence enacted a very similar law in Indiana when he was responding to an outbreak of 190 people that became diagnosed with HIV in a small rural town. And that led to this bill that they passed so as to make sure that people weren't sharing using dirty needles. And the Public Health Department will adopt the rules and regulations to supervise and regulate the harm reduction organizations. So harm reduction organizations, or HROs, and syringe service programs, SSPs, would be managed under the Department of Public Health. And there is evidence-based public health intervention that can, this is an evidence-based public health intervention that can help stop the spread of deadly infectious diseases. The HROs and SSPs that exist in a number of places, there's no funding for that by federal law, but it's the question of whether or not to allow it at all, and funding sources would come from elsewhere. But one of the good points is, cut off, no, here I'm back. one of the good points is that as people come in to exchange their needles, and it is a true exchange, it's not just handing out needles, it's a true exchange. As they come in to get the exchange of needles, then they are accessing the healthcare system, and it provides for them, education, counseling, testing, and entry into a drug abuse program, which sometimes is hard to get into. So the case that if they came in and really were wanting to get treatment, if there was a time lag until they could get that treatment, then it would be nice to at least know that they were using clean needles. Also, think about how people dispose of dirty needles. They may throw them in a trash can, throw them in a lot of different places, and they could get somebody else could get stuck by those needles, such as a law enforcement officer or first responder or someone picking up the trash or garbage could accidentally get stuck. So having these dirty needles off the streets and into a secure location where they're disposed of would minimize the inadvertent needle sticking that could also spread the disease. Also, as I mentioned before, during the time that people are waiting to get into a drug treatment program, at least they wouldn't be at an increased risk for these diseases and would be waiting for proper treatment of their initial addiction. So that is basically HB 161 this year, and of course we addressed it last year and it passed unanimously.
Thank you. Question, Representative Ronders?
Yes, thank you, Mr. Chairman, and I hope some of this here is from the Department of Public Health as well. Mr. Chairman, do we know that if they're going to be speaking on this?
I'm sorry.
From the Department of Public Health? Okay. If I may, because Representative Price is very good at digging into the weeds, so if you'll allow me to dig into the weeds on this particular language. Okay?
Mm-hmm.
I'm very concerned, and a couple young ladies from harm reduction in Fulton County, I think it was, came and spoke to me about this particular bill. I shared this with them, and I find the same language, so they told me that they understood my point. So I want to make sure that I understand. When I see on line 18, the third word counseling, anybody that does counseling, how about after that, homeless service or advocacy? Anybody who's an advocate for anything, the public of Department of Health could give them regulations through rules and regulations on exchanges? Any advocate of any kind?
I believe it's referring to advocates.
But it doesn't say that.
Is there language you would like to suggest?
Yes, I'd like to suggest that you actually strike counseling, because I'm not interested in a marriage counselor doing an exchange. That's such a broad term. Homeless service, I don't think has anything to do with, I agree with your drug treatment, your screening at risk, your syringe exchanges, your drug treatment. I think all that's appropriate, but I think it's irresponsible for us to give up our right legislatively when we're going to go back home and someone can say, well, the state did it because we gave it to an agency. So they can make a determination on who's counseling, who's advocating, and what is designated as a potential homeless service. If my church fed the homeless once a week, that doesn't make them anywhere qualified to be able to get involved in exchanges. And I know this doesn't mandate this, but this puts them under an umbrella that I'm not prepared to sign off on, and I would hope that we could tighten up the language to avoid any unintended consequences. Would you agree?
I'm trying to decide whether this would just limit the number of locations or limit the types of people doing it.
Do you want anybody who's called an advocate to be able to exchange syringes?
If it fits under the rules and regs of the health department,
that you don't know of what
then
it
I
is
don't know
yet?
what they're going to be yet. You're right.
I just think we should be cautious with that and make sure we've got the right language, Mr. Chairman.
Okay. Silcox?
Yes, I was going to similarly say I think this is a great idea. I think it's so needed, and the intent, the author's intent is great. But similarly, harm reduction organization, I guess you were trying to capture every potential organization, or are we just talking about, I know of nonprofits that do this, but you tell me, harm reduction organization.
Well, I think if it's handled, one for one, I mean, somebody's not going to bring a dirty needle unless they're using them. So as long as it's handled and disposed of properly and numbered the way they're given out, so it's not like you just give them a box and say, give them this out as you feel like it. But if they're given a certain number and they document, and I hopefully trust the Department of Public Health to make those details and accountability for who's getting the needles and who's returning them in those numbers, then I really don't have a problem with it. But I can see Chairman Reinder's point that it does loosen up the possibility that more needles will get out there that you don't want. And that's what we don't want. We don't want it so easy to get needles that we actually create new addicts. And that's obviously something we want to avoid.
Now, I would think, Chairman Reinders, I would think we're talking about drug counseling here. Would it help you if we put the word drug in?
I would honestly tell you what would help me, and I know we're trying to go down the right road here, but I think it's too vague and too broad. Advocacy, I don't know what that means. But I do think what I would prefer personally is to have the Department of Public Health come to us like so many others do with an agency bill so we know exactly what they're doing before we vote on something under the promise of we think they're going to do this.
Let me have Chairman Cooper speak to this.
Okay.
Representative Reinders, all of the rules and regulations promulgated by any of the areas that have to do with health come to me and Senator Unterman, and we can evaluate whether we think they're out of line or they're within line. If we think that they are not tight enough and stuff, we can have a great deal of input on them. I would like to know, I'm sure we have somebody from public health or we have somebody with the advocacy groups that maybe could shed some light on this, like what we do now, what's permissible now, and maybe clarify some of this. And I will say, Representative Reinders, that sometimes it is the people from the churches who are the ones that go out at night and go under the railroad bridges and under the bypasses and who try to help these people. And, trying to get a drug addict to use a clean needle and not share, you don't have to have a master's degree to do that. And I don't see the problem with worrying about others, but if somebody will come forward and identify themselves, I think that would help us.
It's Katie Kopp. I'm with the Department of Public Health. And I believe what might solve your problem is if you wanted to remove the words counseling, homeless services, and advocacy, that might limit and get to the organizations that you're looking for.
So you're in favor of striking those language?
Right, we would be
That's
fine
all I
with that,
want.
yeah.
Which ones would be?
That's all I want.
Which
if you were
ones?
to remove counseling, homeless services, and advocacy,
Okay,
I mean,
counselors.
it's certainly up to the author of the bill, but I would think that would eliminate the issue of broadening it, and I think it would still include the organizations that are intended.
Representative Henson? You have a question?
Yes, I do. And I listened to our chairwoman about the people that do go out during the night, that do go out into dangerous situations to help the homeless, to help those that are out on the street. And are we going to be eliminating them or not allowing them to help if we strike those words? And I just have concern with that. They're the ones that are on the street with these folks that are not necessarily coming in to ask for help or to the buildings during the day or to the clinics. And that's my concern with striking those. If we could find other words for it, that would be great. But I think those folks that do the counseling, that are out on the streets, that do the homeless services, that are advocating for them are an important component of trying to help these folks get over their drug abuse.
Can we ask if there's anybody else that wants?
May I respond?
Oh, what'd she ask me?
Mr. Chair.
Representative Henson, you are asking the question of the Madam Chair?
Whoever wants to answer it, I'm just saying that if we take out those words, I'm concerned with the fact that the folks that are out there that Madam Chair was referring to would suddenly have language that would not permit them. Right now, they're probably allowed because we haven't directed this, and if we suddenly take that out, are we now not allowing these folks to do this? That's my question.
Do we have someone?
You won't. You go ahead.
Do we have someone else that would like to speak and elaborate on that? We had somebody from the Department of Public Health. Ms. Tian, you want to do this? Because I know you've been in the trenches with HIV. I'll have to give her a little bit of accolades. I just realized that she had been recognized by the legislature, the Hawaiian legislature, for her work in the early 80s when we were first learning about HIV.
How do you know that?
And her work to make realistic laws. At one point, the Hawaiian legislature had a bill in it that would have had them tattoo an A on their forehead. An A on their forehead for AIDS of the people that were HIV positive, in a overreaction as we were learning about this illness. So thank you for your work. So if anybody knows about this kind of work, Mrs. Tian does. Okay.
I'm just going to, you want me just to address this, the counseling, homeless services, and advocacy?
Yeah, I think it's a hair
Okay.
broad, or tighten it for
Okay.
me.
If you, in my opinion, if you want to remove that, I have no issue with it, but I will let you know that this is how it is defined in current law. So currently in the law, this is what the definition of a harm reduction organization is. I'm not exactly sure what part or where it falls inside the current law, but it is. But I don't have any issue with you removing counseling, homeless services, and advocacy. The reason why it's code section 26-4-116.2.
Okay.
Madam Chair, if I may, that's two public health officials that have told this committee they don't have a problem because with removing those three words, because we don't want the unintended consequences. And I just say simply, let's strike it and pass the bill.
Okay.
Yeah, go ahead.
Okay. Betsy, is there any problem, since it is in other areas of the law that a harm reduction organization means and it's defined, is there any problem with us striking that?
There's no problem with that, but I want to make sure the committee understands that all those lists of services are modified by the word starting on line 19. The services to at-risk individuals to slow the spread of HIV and other infectious diseases among intravenous drug users. So you have to read all that in context. There's no problem to strike that. It is defined in that code section. I can't remember what the section of that code section is. For other purposes, you can define it here differently. There's no problem with that. The language starting on the end of 117, such as, these are simply examples. So including them or not is not going to change the authority of the Department of Public Health, in my opinion, as far as what they're going to do.
But what you're saying is this is not a huge, it is certainly an important population that we need to address, but are you saying it's not a huge population and it's only with intravenous drug users?
Right. These services, yeah, when the Department of Public Health does rules and regs on this, they're going to be defining organizations that provide services to at-risk individuals, for IV drug users. So it's pretty easy to read all those pieces together. It's just a lengthy sentence, so.
And also you have the Department of Public Health authorized to promulgate the rules and regulations for the purpose of. So you've got a secondary. I tell you what, we've got Jacqueline Whitfield. Would you like to come up and speak to it?
Thank you, Mr. Chairman, members of the committee. I'm Jocelyn Whitfield with Grady Health System, and I just simply want to say we support this legislation. Grady has one of the largest infectious disease programs in the region, and this is evidence-based public health intervention that helps stop the spread of deadly infectious diseases. We support it.
Derek Norton.
Afternoon, Mr. Chairman, or Madam Chair, I'm not sure who's in charge up there. Derek is detained elsewhere in the Capitol, but Medical Association strongly supports the bill, appreciates Dr. Price's efforts, and urge do pass. Thank you.
Representative Sharper.
Thank you, Chairman. Just quickly, when it says it shall be unlawful for any person or corporation other than licensed pharmacist, what would be the penalty for this? Is that somewhere in another code section, or I just want to just get a little insight on what the penalty would be.
Betsy?
I don't know. We're only seeing subsection C, this code section. I don't know if it's a misdemeanor or a felony, frankly, but right now it's illegal to do needle exchange except for these exceptions, so an add exception to that. I don't know if it's a misdemeanor or felony though.
Or do we need that added at this point, or not really?
It's already in the law.
I mean, okay, I got
just
you.
don't know off the top of my head what it
Okay.
is, so it is covered.
Okay, I was just making sure.
Mr. Chairman,
Yes.
right here.
Oh, I'm sorry.
That voice. And
I know. Where does that come in?
I understand there's another person to speak if they were or weren't on the list. I don't know.
I don't have them on the list. Oh, okay. And, I'm sorry, I can't read it. Ann Mintz?
Like a mint with a Z on it.
Okay.
Yeah. I'm Ann Mintz, and I represent United Way of Greater Atlanta, and I'm here in support of Representative Price's bill. We can speak to the value of this bill from a couple of respects. First, we administer the Atlanta AIDS Fund with the Community Foundation, and those grantees have asked for this kind of latitude. We also, as a separate initiative, have our Street to Home program, and we've been very successful in getting people into supportive housing. But it works like this. We have an army of volunteers that'll go out in the middle of the night, early in the morning, and ask people if they're ready to change their lives. And if they are, we will get them into supportive housing and get them into treatment. But oftentimes, a lot of those folks are not yet ready. You know, sometimes it takes 5, 10, 15 times of asking someone, do you want to change? So in the meantime, before you want to change, possibly we would like to keep them alive until they do change. So having this latitude to be able to do a needle exchange for some of these folks would be greatly valuable to us. So I was very pleased when I saw the bill, and I'm hopeful of your favorable consideration for it.
Thank you, ma'am.
Okay, can I speak again?
Yeah.
Mrs. Tehan, how many states have this kind of program with this kind of latitude?
I do not have an exact number, but there are a number of states that do needle exchange, and more states are allowing it because of what's happening within the hepatitis C epidemic that we're having as a result of heroin.
Am I correct in when patients or when people contact hepatitis C, that the long-term effect is liver failure? Is it liver failure and kidney failure, and they
cirrhosis and liver cancer?
Cirrhosis and liver cancer.
And they end up on the state's Medicaid program?
Yes. In fact, in 2015, we had a total of 13,958 new cases of hepatitis C were reported inside the state, which is an awful lot of cases of hepatitis C. And it was primarily related because of the heroin epidemic. And the other thing that we were seeing, or we have seen, is in 2016, we have had a 193% increase in hepatitis C infections in babies, potential hepatitis C infections in babies 36 months of age or younger. So we're in the middle of a very bad epidemic, and we need all the tools that we can get in order to prevent the, to stop the spread of the epidemic. And this is costing us an awful lot of healthcare dollars.
And people having clean needles has been proven to be an effective way to reduce the number of hepatitis C.
Yes, because the hepatitis C, you're more likely to get hepatitis C than you are to get HIV, because hepatitis C lasts longer inside a wet medium, like inside a syringe or in the edge of a needle, and it can stay, I've got the number someplace, but I think it's like a couple of days. So it lives for a few days inside versus HIV, which is a little bit more of a fragile virus.
Okay. So I guess the question to the last thing I have to say is the question with committee is the committee has to decide if having it in the definition, which is already in other parts of the law, is the risk of somebody having or somebody getting a few extra clean needles
And I have here
outweighs
now
the
that
value of trying to get as many clean needles as to many addicts as we possibly can to reducing the number of increases in cases. And if that's the case, I think we just have to decide if we want to pass. I'm sure Representative Reinders has an amendment. And
Madam Chairman, I have that there are about 200 needle exchange programs in 33 states.
Okay.
Representative Sharper.
I'll be brief, Chairman. As been on the front line as a paramedic, we come in contact with a lot of people that we don't know what their status is at this time, And also, it's my understanding that by us doing this is also going to help the people that are actually doing it, illegally. We will help give them some basis so they won't be in an illegal, situation. So at the appropriate time, whoever, we're going to go ahead and pass this thing. We need to pass it because it is a good bill, and I want us to be safe, and I want the people to go ahead and continue what they're doing and increase. Thank you so much.
Representative Henson.
Just to continue on the hepatitis C vein, I don't know how many watch mainstream TV, but I do. And one of the latest ads that I've been seeing recently is directed to baby boomers, of which I think there are a few of us in this room. And that is to get tested for hepatitis C, because it can stay in your blood for years and years and years before you have any adverse effects at all. So it is something that's out there and something that we need to be very conscious of. Just wanted to add that, and I feel that we should go ahead and pass this bill as it is as a substitute.
Representative Newton.
Thank you. I was just when I look at this, I do appreciate the people who go out to those dangerous areas and meet people who are abusing drugs and try to give them a good option, and if they don't want that, give them at least one option to keep them alive and off some of the expenses. Just when I look at this regarding leaving out certain parts of the such as the syringe exchanges, I'm okay with it, leaving it with that. Once you can do syringe exchanges, that may be what they're planning to do when they go out, and as long as the Department of Public Health calls it. Okay.
That was never part of my syringe exchange. Is good. That's what we're supposed to be doing.
Okay. Thank you.
Representative Reinders.
Thank you. Please let me be clear. I don't think anybody on this committee doesn't want to stop this program. We've got a spectrum. And if we do it on just about saving lives, the spectrum should be anybody should exchange. We can't do that. Anybody can exchange. That's one end of the spectrum versus making it so tight that only one place and one part could do it. We don't want that either. What we want to do is we want to supply as much as we possibly can to protect the people that are most at risk. That's the obligation of this particular bill, and that's what we want. We've got the Department of Public Health that has told us twice as a committee that counseling, homeless service, and advocacy is okay to be stricken because it is broad. None of us know what that means, and we're going to give that authority to someone. And I just think at the appropriate time to scratch those 3 words, make sure that it's not overly broad nor too tight, and that's simply my intent.
Warn me down. Make your amendment. Because we want this bill to pass.
I love you. At the appropriate time, I'd like to make an amendment.
I think you warned him down.
Pardon me?
I think you've worn her down too.
I
Go ahead.
understand. And I understand, you know, I can see the chair's reaction, and you may want them to vote my amendment down, but I simply think to find that right balance, we just simply strike on lines 18 and do what the Department of Public Health has said is okay with them. I want that on the record. To strike counseling, homeless service, and advocacy.
Don't hear anyone to move the amendment.
You need a second, is what he's asking.
All those in favor?
Aye.
All those opposed, say no. Okay. So the amendment has passed. So now we're on to voting for the bill with the amendment striking counseling, homeless services, and advocacy. Do I hear a motion?
Motion do pass as amended.
Yes, motion do pass. Second. All those in favor say aye. All those opposed? Ayes have it. That's it. You have anything else? I don't think so. Okay. We're adjourned. Thank you.